I want to talk to you guys about the RE-GEN Bioactive EndoPutty by VistaApex. And this is a really nice material that I had to use on this case. So this is the pre-op on his lower premolar. The root canal looks pretty good. We did limited field of view 3D CBCT. You can see there's some periapical pathology present. And look at this, there is also some pathology on that lateral root. Could be a missed lateral canal. But on this view, there's no crack, so the bone looks good. So we did a 1-visit retreatment. This is my comb fit. We obturated this case with bioceramic sealer. Case went very well. The patient returned in 6 months. There was no healing evident. So we brought the patient back in a year. There was still no healing evident. Patient wanted to do an apical surgery, so we decided to use the Bioactive EndoPutty by VistaApex. It's ready to use. It stays in place, and its fast setting is why I really like this material. So you can see me using this material here. I have some in my fingertips and I'm kind of rolling it around, and it has Cavit-like consistency. And the reason why I like it, it doesn't slump over. So when you do your retroprep, you can really get it inside the retroprep, and you can also burnish it if you need to by using the ball burnisher as well once you get it in place. So it's really easy to use. It sets up really fast in an hour, and it gets really hard. And you can also use it for perforations as well. So this is me using the material in a cup, and this thing gets really hard. So this is after like an hour or so, and I'm shaking this cup around. You can see how hard this material is. So this is the osteotomy here. So this is when we laid the flap. So now we are exposing the buccal aspect of the root, and we're removing the defect here. And you look really close and you can see the root canal filling material as we are preparing our osteotomy here. So this is our irrigation with some saline here, and we are getting ready to do our retroprep here. So as we are cleaning it out, this is our osteotomy here, and we are enucleating the lesion here. We're cleaning everything out really well, curating that area, and also irrigating it with Retrx here. So we're removing all that granulation tissue. And this is our retroprep here. As we retroprepping, there were 2 roots in the apex. So this is our retroprep, getting ready to use the Bioactive EndoPutty. So this is the Bioactive EndoPutty here as it's in place, and we can see it's very tacky and easy to use. We can push it right into that retroprep material. So I'm using the other side of the instrument, just kind of burnishing it in place, making sure that it's really set and really good. And so we are now suturing up this gentleman. I like to use interrupted sutures, and also I like to use resorbable sutures as well when I perform my apical surgeries. So this is the post-op of the apical surgery. So we're going to get this gentleman back in about 6 months to make sure everything heals up. I'll talk about this in my textbook and also in my lectures.